Go to welcome Chris Ausura to join us today from the Rhode Island Department of Health. Um, Christopher is the co-acting director of the Health Equity Institute, and in this role, Chris leads efforts to establish and sustain the Health Equity Zone initiative, which we're going to hear about today. He directs the Preventative Health and Health Services Block for COVID health disparities grants. He leads the healthcare equity team and supports efforts to improve social and environmental determinants of health, with specific focus on economic, housing, and healthcare sectors. So, Chris, we're really excited to have you today. I'm going to stop sharing so that you can share your screen. We can hear a little bit about the work that you've been doing.
Thanks, Chris. I had to figure out how to unmute myself as I went to share the screen and move away from the prior screen that I was looking at. Thank you all so much for having me. Again, my name is Christopher Ausura. I'm the acting co-director of the Health Equity Institute here at the Rhode Island Department of Health. I also serve as the director of equity operations for the department and support a number of different projects at our Executive Office of Health and Human Services. I'm here today to talk a little bit about one of the core projects that we've been promoting over the course of the last really about 15 years here, but really actively over the course of the last 8 years, which is called the Health Equity Zones Initiative. I know it's a little bit unorthodox or maybe a little outside of the bailiwick of the work that you all are usually doing to work in the space of health and healthcare, but I think that the framework that we've established with the Health Equity Zones can present or provide a tool that other organizations or other sectors can leverage to improve outcomes in partnership with communities across the nation. And I'll talk a little bit more about how we're doing that in partnership with other states in just a moment. But I'm going to dive right in and talk a little bit about how we got where we are today and really what drove this work here in Rhode Island. In and about 2008, 2007, the science around public health was really shifting, and it was shifting to an understanding that social environmental conditions were what were the underpinning or the drivers of health outcome, and a recognition that much of what we within the public health sector and the healthcare sector were focused on was the treatment of individual patients or individual diseases. And that really obviously is incredibly important work, and it's important work particularly to those folks who are being impacted by those chronic diseases and those outcomes. But it wasn't changing prevalence, and it wasn't changing outcome, and it wasn't really adjusting or impacting the trajectory that was, leading to a decline in population health outcomes as well as a decline in life expectancy across the nation. So at that time, the CDC had worked to create a new framework. That looked at social environmental conditions as sort of the structural drivers or the structural barriers to health. And in understanding that, these individual interventions that we had been previously pursuing really were requiring a significant amount of resource, but were having marginal impact because we were not getting to enough of the population with the intervention to be able to change prevalence across population outcomes. It's a little bit in the weeds, but the long and the short of it is that the social and environmental conditions are the places where people live, play, pray, and work. Those are the places where health is really determined. And the easiest way to understand that is you don't live at your doctor's office, right? You live in your community, and the social environmental triggers and social environmental factors within your community have a lot to say about what's your health and what's the prosperity of your particular community. So as we understood, or as the science was changing to respond to the reality that we were doing a great job addressing folks who are already sick, we were doing a great job implementing programs and projects that were really targeted at supporting those individuals, we didn't have tools, or we didn't have resources or a portfolio of work that was really targeted at those structural barriers, right? Community design, environmental triggers, social environmental or socioeconomic challenges or barriers within communities. And we need to do something different. So we created an initiative which was called the Centers for Health Equity and Wellness. And that was a project that we implemented for about 4 years. And we learned a lot through those grants, and we affectionately called them CHEW, not least of which, though, was that community capacity and geography make a huge difference as it pertains to how we can be effective at addressing and improving outcomes, really at the structural level within communities across the state of Rhode Island. And we had deployed these grants really with the understanding or the expectation that if we were to make some investments, some targeted investments in social environmental conditions, and I give a concrete example of food access as one of those, targeted investments that we had made at that time. What we realized was that the trajectory of change or the time that it takes to impact and influence those conditions within the community was not aligned with the grant cycle that we had deployed, which was a 3 to 4 year project. The resources that we were providing, although substantial, were inadequate to making a difference to the really, entrenched challenges that communities faced, and that different communities were experiencing different structural barriers in ways that we had not previously anticipated or expected, but now obviously seems sort of, well, duh. A good example of that is that, if one community's challenge is really that they don't have good transportation to get to the local grocery store, what they really need to focus on is either solutions for folks who are food insecure to get to those locations or ways to get food to those folks that are food insecure. However, there are other communities that we were working with that just didn't have a grocery store. And that was a completely different issue and required a different set of solutions. So the context of the community made a big difference as it pertained to whether or not we were going to be successful in achieving some of the goals that we had for aligning the work or sort of aligning our priorities and our approach to addressing structural determinants and improving outcomes within those communities. So with that, we launched an initiative called the Health Equity Zone Initiative in 2015 that really was designed to allow us to think fundamentally differently about the relationship that we have with communities and the community-based organizations that represent them, and change the narrative of how we were both contracting and approaching the work, but also recognizing the essential building blocks of if we wanted to be successful in the space, if we wanted to advance work that was going to impact these upstream drivers, and structurally, it needed to be an approach that was designed from the bottom up to be that kind of structure. And health equity zones are really, again, intended to be built out to do this focused upstream work. They're targeted at the place because we recognize that there's a distinct difference, as I described before, in each geography, and even similar populations and similar demographic groups in different geographies are going to be experiencing different proximal drivers within their particular geography. So geography made a really big difference. We recognized that it wasn't enough to be transactional, and it wasn't enough to bring one grant in or one priority in. We needed to think about the system and the structures of those systems and how do we work at those systems level. We needed to activate partnerships within the community because it wasn't one organization, it wasn't one entity, it was everyone within that community that held different pieces of the levers that would effectuate change. And we need to intentionally invest in capacity because what we recognized in the work that we had done previously with our true grantees was that although there was a willingness within community to drive change and an interest in improving outcomes, the capacity at the community level really was not sufficiently resourced over time and therefore was kind of non-existent in a lot of the communities that we had been working with. So HES effectively works by starting from an equity foundation and building up and building out a framework that is a replicable framework that can work in any community and any state in the nation, in fact, internationally. The idea starts with the community self-defining the geographic location. And the rationale here is that if we come in and say, here's where the issues are the worst, here's where the disparities are the greatest, here's where the data is telling us the priority is, and we want to do this work, we as the state are coming in the door and inherently creating an inequitable relationship between us and the partners within that particular geography because we're defining and we're determining what's important. We're determining where is important. So we start from this place of equity and this foundation of equity with the community to say, you tell us, you tell us what your community is, you tell us who the people in your community are, and you draw a boundary around that particular community. And the reason, in addition to what I've described before, is that demographic populations or sort of groups of people may exist over what we consider to be traditional geographic boundaries. So we may say it's the census tract, we may say it's the zip code, but it really could be a connection of a couple of those different things where it could cut through multiple zip codes or cut through a zip code or cut through census tracts, because that's what the community says, hey, this is our neighborhood, this is our place that, we're all actively working to improve. So folks define what their geographic location is. They come together and identify a organization that's going to apply on behalf of their community to be what we refer to as the fiduciary agent or the backbone organization. We then resource that backbone organization not as a single entity that is going to be the leader of this work, but really as the recipient of funding that then will distribute those resources out to the community. And the first thing that they do is build or enhance a collaborative. And the expectation there is that they may have some critical mass. There may be some level of folks working together already in that particular geography, but we want to enhance that. We want to grow that. We want to build that out. And we want them to bring together not just the usual players or the folks that are associated or affiliated with, let's say, a public health intervention, but everyone, the entire community. They then take that collaborative and they work together to conduct an assessment of the needs and assets. And this is a formal needs assessment and asset mapping process. They take what they find from that asset and needs assessment, and they go back to the community. And we resource these folks for a full year to do this assessment process with approximately $150,000 per community, and give intentional time so that we're not rushing, so that we're not saying you need to get to answers as the first step. The expectation is that we want to create this, we set the table for a conversation with community residents where residents can really come and describe what is important to us, not the organizations within the community, not some of the leaders within the community that may be representing particular community-based organizations that serve the community, but the actual residents of the community. As those folks who are part of that collaborative, including community residents, go through that prioritization process, the next step is to develop a formal plan of action. And that action plan serves as a reset for the relationship that traditionally exists between a funder at the state level and the communities that are doing work. And that typically we as the funder dictate and determine here are the resources that are available and here's the work therefore that needs to be performed. That action plan is a foundation for us to equitably invest in that community and is a way for the community to self-determine and self-define what is actually important outside of or agnostic to what the priorities are of one particular funder. To give an example of what this looks like, this is a quick sort of visual for one of our health equity zones, which is the Central Providence Health Equity Zone. What I want to call attention to here is that the center of this bubble is not an organization. It's not an entity. It's not an individual. The center of this bubble or the center of this map is the actual health equity zone. It is the collaborative itself. It is the folks who are coming together. The second thing I'd like to call attention to is the fact that this is a diverse group of vested stakeholders who are working on behalf of the community that are coming together to work collaboratively outside of their silos. And there's work that's going to happen. There's work that's going to be layered on to each of the different specific bubbles that you see here that represents, the challenges or the priorities of the work that needs to be performed in the community. But the idea is that health equity zones, or the concept of health equity zone and the framework that's available, allows folks to come together and bring those resources to the table and talk about what the connection points are and how they can leverage and start to build that strength and build that capacity within the community, both to react and take the resources that are currently available, but then also to start having those conversations about, well, how do we use the power of this table to start driving the narrative to get the resources that are really needed for our community so that we can drive the change that residents in our community really care about. To support this work, we've had to really do some internal digging and think very differently about how we look at data and how we measure data, and particularly what we mean when we say social determinants of health. And what we recognize in partnership with our community partners was that we say these words and we were saying these terms and sort of just throwing them out there as if everyone had a common understanding and a common agreement of what social determinants of health and health equity was. And the reality was we didn't really have a core measure set. So we started that process off and spent about 2 years looking at over 200 different particular indicators, working with partners from philanthropy, academia, government, community-based organizations, community residents, healthcare, sort of across the board, and landed on 15 different measures or 15 different determinants that live within 5 domains. You'll see that physical environment and natural environment, environmental hazards is a core component of the work that we're doing because we understand that the physical environment is one of the primary drivers of both prosperity in the community and positive and poor health outcomes. So where we are today, there's 15 health equity zones in Rhode Island. It covers 26 cities and towns, and it's about 85% of the state residents are currently being served by a HES. Within those 15 health equity zones, there are well over 300 exclusive organizations, and that represents over 20 different sectors, both from the private, public sector, as well as different faith-based organizations and different community organizing groups and community residents. For a state like Rhode Island, who has only 1 million residents and just a few hundred community nonprofits, this is substantially covering our state and substantially convening the different stakeholders and the different leaders within our state. All of this feeds into what is our theory of change for this work. And as I described before, we're intentionally investing in the establishment of community capacity and community infrastructure with the understanding that if we hope to achieve change to social environmental conditions and improve conditions for prosperity and health and wellness in communities, that community capacity is effectively the linchpin. And the ability of the community to self-define priority gives us the understanding of what really needs to be invested in. It gives the community both the voice from a justice perspective, but also from an efficiency and efficacy perspective, helps us better understand as we deploy public and private resources, where should these investments be made and in what? And that's really our responsibility, and that's that center bubble, is that the state's responsibility is to work with communities to build them up and build that capacity to understand what the challenges are, but then also what are the solutions that the community who is best positioned to articulate and drive change for their own community, what is it that they need? And as we understand that situation better, as we understand those realities better, our responsibility is to align the resources that are available to us now and the resources that will be available to us in the future through conversation, both with our legislature, with federal funders, with philanthropic funders, really using the institutional power that we have as government to align those resources with what the community is saying. Hey, this is what we really need. You keep investing over here, but what we really need is we need changes to our transportation plan in our particular neighborhood, because this just excludes a whole swath of the population. So we need to change that. And that's the investment that we really need. And not just we don't want it to look like this, but we want it to look like that. And those are those solutions that we feel that as investing in the community and building that capacity, they are best positioned to provide to the state. And as you see here, the theory of changes as we build that capacity, as we align those resources, we're going to see positive changes to those social environmental conditions, and that will lead to higher prosperity and better health for the people within those particular communities or across the state of Rhode Island as we continue to expand. This all exists, though. Obviously, it sounds great in talking points, and it sounds great when I say, we're just deploying this resource. But the reality is it's very complicated and it's very difficult work at the community level. And the rest of the system is really stacked against this type of approach. It's really designed to achieve a particular outcome. It's very transactional in nature, which is not a bad word, but it's just a realistic thing, is that the investment is for the thing that the appropriation has been made for. Because of that, there's minimal resource that exists within most geographies in any state in the nation to support folks coming together and leveraging those resources in self-determining what is important for their community and driving the narrative. It's very top-down versus bottom-up. And what we're working towards is to move folks along this continuum. And I will say that each of the health equity zones that we work with are in different places in this sort of pre-hes, startup, developing, and established, based on the different aspects that you see on the left side of the screen here. Some folks do a really great job on community collaboration, and they're really struggling on their prioritization and needs assessment and making that an actionable strategy. Some folks do a great job on creating prioritization or assessment, but they don't really do a great job on engaging with residents, and it's really still being driven very much so by the organizations rather than the people within that particular community. But what we're working towards, and what the North Star for us is to move from this very siloed, very sort of disorganized and top-down model towards a space where there's a greater level of organization and coordination, and the direction and priority is really being driven by the people who exist within that particular geographic location, and ultimately across the entire state of Rhode Island and hopefully the nation. We refer to this really as a change from the transactional state or transactional reality towards a more transformational state, which is that we're investing in the transformation of communities, not just transactions on particular outcomes. We achieve this in large part by the capacity or the capacity development, training, technical assistance, and support that we provide to the community, as well as significant financial investment into the communities using a braided funding model. But we have a training and technical assistance program that is intended to not bring particular resources related to one outcome or one priority area, but invest in these development of the leaders within community. And the idea is that quarterly we host these training and technical assistance forums, as well as offering communities of practice to folks that bring both local, regional, and national experts to Rhode Island to have all-day convenings with residents and resident leaders and community-based organizational leaders to build their capacity to drive this sort of change. It's sort of like professional development, but for everyone within the community that's doing this body of work. We evaluate and we look at the impact of our work very differently than we did when we first started. Much of the challenge that we've faced very early on was that the evaluation and evidence base is really stacked on an equality model, meaning that we'll compare communities in Ohio or Idaho to communities in Rhode Island and act like those are going to be the same thing. And we'll implement the same strategies in those places. And what we realized was, as we focused on outcome, as we focused on those transactional changes, we weren't capturing the thing that was really the essence of what we were hoping to accomplish. And because of that, we've created what's called a contributory complex system equity-based evaluation model that really centers community capacity as the key priority for advancing change. And the idea here is that programs will come and go, priorities will come and go, but the capacity of the community to drive those changes within their particular area is the piece that is essential for us to be successful. And we can't get there unless we empower the community, right? Unless we make intentional investments in the people who live in those places, not just the organizations. Because if we invest just in the organizations, that's grass tops. We need to build the community up through intentional investment to have more representative community representation or more representative community organizations that have more residents, that are the folks who are really driving the narrative of those organizations that we as agencies in the state, as well as philanthropic and private sector, are investing in. Where are we going from here? You know, we have a model that's really focused on looking at expansion, and we see expansion both as a sort of out and a down. We recognize that we need to grow and we need to continue to demonstrate and share this, this approach to create an evidence base across the nation. We also want to grow across the state of Rhode Island. We want 100% coverage of the state, and then to further diversify within those particular communities to get even more local as we need to ensure that we have that level of partnership with the real community residents in those particular areas, and we're not getting, sort of hung up at that grass top. But at the same time, there's a recognition that there's so much that's already happened and there's so much that's working well. And we want to really sort of double down and triple down on the investment in the communities where this work is already being performed and scale and enhance what's working. And by doing that, by creating a sort of broader umbrella of replication, both locally and nationally, as well as scaling what's working within the community, we're building this sustainable growth model that continues to reinforce the evidence base of investing in community capacity, not just as a means to an end to achieve a particular goal, but as an essential piece of our work as a public-facing entity to engage with these communities and community-based organizations. We also see this sort of falling into three separate buckets, and those three separate buckets, as I talked before, one is transactional. And again, it's not a dirty word. It's just a reality. There's always going to be appropriations that are made because they're transactional and they need to be based on a particular outcome. But those transactional outcomes can work better for the community, and they can be informed and defined by what the community needs and what the community cares about. Catalytic investments are really a space that is a developing portfolio for us, and what we're looking at is to understand, as we get to a certain space, we're encountering roadblocks. We're encountering realities where we don't have adequate resources to get to the next level, right? To get to the next space that needs to be entered into, because those funds just don't exist yet. We have to create the evidence base to be able to say, we need additional resources for this particular thing. And I can give a concrete example that one of our partners recently was in the process of conducting an equitable economic development strategy to share with their local municipality to help drive economic development in one of the most historically marginalized communities within their neighborhood. And there was no money. There was no resource to invest in this community that could catalyze the work that they were going to do that really was going to get to that transformational space. There was a lot of work on transactional. There was a lot of work on here are the problems of today, but not how do we start to create the systems and solutions for tomorrow. And then the last is transformational investment. And transformational investments are really a shifted narrative. It's a portfolio that exists in few spaces, mostly in philanthropy at this point. And it's it's resource that understands that it's not just about the outcome. It's not just about what can I get in the short term. It's that here are the facilitators of what needs to be in place. Here are the facilitators of success. Here's how we make these sort of transformational changes, and our funding is going to be aligned with that type of change. And an example of that is, there are folks that have created some very strong endowments or community empowerment funds that leverage multiple different philanthropic investments and really invest over a 10 to 15 year perspectives, with the understanding that if they want to achieve the type of multi-generational change that their mission and goals as an organization have emphasized, they need to make a different type of investment. So they're investing in a way that's not just looking at one outcome. It's thinking about how do we facilitate success of all of the outcomes in those particular communities that we want to work in. Our goal and really where we're going and what we hope to achieve is a balanced portfolio. And within that balanced portfolio, it's really aligning the transactional community investments and outcome investments with what the community's priorities are. And I talked a lot about that earlier in thinking through, what is the community's action plan and what are those strategies? And as the community develops that capacity, what relationship can we build with those community-based organizations? Say, hey, the goal here is really to work on, urban green space. And, we have some ideas and we have some money, but we're from the state and we don't really fully understand what you and your particular neighborhood need for this. We need a table to sit down and have, 2, 3, 4, 5 meetings with community residents who live in that neighborhood, but also understand what the challenges are and understand, what we're going to need to have in place if we want to be successful. By creating that capacity at the community level, you can sit down and have that discussion. You can have that conversation, not with one resident or the person who shows up to the meeting, but with a group of people who are actively working to improve conditions within their community and to improve outcomes for their community. The second, obviously, is to leverage catalytic investments and to really build out that portfolio and understanding both at the local, regional, and national level that this is an essential piece of the building blocks of how we're going to be successful in addressing, systemic and structural drivers. We need those types of resources. They're called sometimes flexible funding, but I don't like the word flexible. I think that they're targeted funds. They're targeted funds that are there to help us move from one place to the next. And then we need to work with funders using the model that we're using and that other states are replicating, and not in exactly the same way, but this type of thinking, this shift in paradigm that the investment in capacity, the investment in our ability to achieve change is a valuable investment. And here's the evidence base to demonstrate this. Here's the return on investment of this type of resource to build out and to strengthen that portfolio of transactional investing. And that's how we're going to scale and sustain this type of work over time. The last thing I'll share is that, as I've sort of briefly mentioned here, that this is not just happening in Rhode Island, it's happening across the nation. There are right now about 12 states that are actively replicating, and there's another 15 or so that we've had conversations with that are gearing up to replicate this model in their state. We've also had conversations with a number of different organizations and entities over in the UK who are also very interested in how we're approaching really transformational change work. And they're excited to try to start replicating what we're doing with health equity zones here in Rhode Island, in Scotland and Wales and in some other places. So it's exciting. It's exciting work to be part of. There's a lot more to do. There's a lot more ground to cover. We certainly haven't figured it all out, but hopefully it's helpful to the work that you all do on a daily basis. And that's it for me.
Thank you very much, Christopher. I really appreciate that topic. Can everyone hear me? Can I get a thumbs up, Chris? All right, good. Thank you. We do have some good questions for you, but I thought I'd take just a liberty of asking the first one, just because I'm excited about this topic. I was really interested in hearing about a specific case, a specific community that went through that process and maybe some lessons learned or an output or a product from that specific health equity zone.
Hopefully I'm understanding or interpreting the question right. And maybe I didn't hit on it clearly, and it's a great question because I think it's really important, is that, the 15 health equity zones that we're currently working with, we're investing in those communities in perpetuity. The idea is that once we make an investment, once we work with a community to establish a health equity zone, the backbone may change. The partners who are on the table may change over time, but the health equity zone itself, the convening, the capacity, the collaborative that exists within that space, that's forever. That's an infrastructure that we're intending to invest in permanently. And those folks have really moved through that continuum of what I would consider to be sort of low trust, more transactional alignment, to starting to think through, okay, let's forget about the health department for a second. They gave us this money, and let's talk about what do we actually need. And they've been able to secure significant resources for their community outside of what we've provided to them. And many have become, I don't want to say fully self-sustaining, but many have really built out portfolios that are outside of what public health is really focused on.
Can you tell us a little more about how you get investors to fund something like urban green space or another green infrastructure ecosystem services type project? What would the ROI look like?
I don't know that I can speak to ROI as not being an economist, but I will say this, is that we have been very successful in bringing together the appropriate stakeholders. I think what we had experienced sort of early on was that communities would either have an advocate or an organization that was really pressing for a particular type of change. And that advocate would go out and work on behalf of that priority area. And they were sort of like a lone wolf in the world of trying to convince people that this was an important approach. Because of the structure that exists and the power and the dynamic of having a community collaboration, it naturally attracts the municipal leadership and the people who are, whether it's the mayor themselves or the city councilor themselves, it starts to attract people who are sort of within that space. Because they go, wait a second, our community is convening, they're talking about what the future looks like. We need to be there. We need to be part of this conversation. And you also get a lot of the power players. So you get leaders from different organizations because, it's like the old adage, if you're not at the table, you're on the menu. So everybody wants to be at this table, right? And when it works well and you're having high level conversations, what tends to happen is you create a governance structure that has sort of like, here are some folks that are having these really sort of heady conversations. Here are the people who really know what's going on, and we're connecting the dots between the two of them. And what will happen is, as the action plan demonstrates and says, we need to work on this project that is around, urban greening. Instead of it being one individual, one organization saying it, you start to get this collective agreement that this is something that our community needs. And you have the right people at the table to take that information and to start championing it with the folks that really need to be the ones to hear that message. Particularly with municipal leaders, with the resources and revenue that they have either available to them or that they can go after. They then can be the messenger, to go after resources that maybe an individual community member or an individual organization would not be successful in otherwise acquiring. And we've also seen that a lot of the folks that sort of invest in multiple different spaces, not just in urban greening, urban renewal, when they see multiple organizations working together and leveraging their existing resources, it gets them really excited. They say, well, I don't have to fund everything. Like, I can come in, I can plug into the thing that I do, right? Because these folks are already having these conversations. The planners are already talking to their residents in this particular community about what the priority is. So I don't have to fund the work for the planner to go and sit down and have those community convenings. Community convenings are already happening. I just plug into that. And it helps them stretch their resource further, and it becomes a more attractive investment. It doesn't always work that way. And I think that what we have found is, that process of evolution through being very responsive or very reactive to the funding that's on the table versus what the community's real needs are, and the voice of some folks around the table of, sort of structural change, or the importance of some of the more structural, social, environmental, or particularly environmental changes. It can take time to get through some of the really more urgent stuff. I mean, I think in one of our communities that is getting to that space of having some of the environmental conversations, they have the worst opioid crisis in the state. So before they're at the point where they're talking about, what do our communities look like, they're saying, look, our kids are dying, and what are we doing about that collectively as a group? And we have to trust that process, and we have to support that process of letting the community self-determine and self-define.
How does the communication work? How do you get the right people at the table? What has worked in that regard? And there's a question in here about how have you kept communities engaged in this work over the years? So kind of a communication.
Yeah, that's a really good question. I think that the intentionality and the time, the commitment is a huge piece of it. Early on, there was a lot of attrition. There was a lot of, you know, y'all are saying you're going to do this, and then look, you're doing the same thing you always used to do. Um, and there was a decent amount of turnover as communities have gone along that continuum, as the relationship within the community has changed from one or two or three organizations holding all of the power and making decisions to there being a forum and a collective and a group. We've actually seen the power dynamic shift, and we've seen, you know, organizations that used to be the ones that would speak on behalf of the community being told by, you know, 20, 30, 40 resident leaders, stop doing that. You know, we'll make the decision, you come to us and you can be part of our steering committee, but you're not going to chair our steering committee anymore. And as residents and, you know, organization leaders who have not traditionally been part of that power structure have had that opportunity to really, you know, grow into that space, it naturally keeps them at the table, right? I'm not going to say that there haven't been community partners who said, look, this just isn't for us. We're going to go do the thing that we do, and we're not particularly interested in doing this other thing. But I would say probably for every sort of person that walks away, three more people are there to take their place because they see the opportunity. We've also seen significant growth in resident leadership, folks that were maybe come to a meeting and were interested in a particular issue, that because there's a space and there's actual investment of real dollars into the building of capacity and the leadership within their community, they've grown into roles within community-based organizations that has then helped to recruit additional people from those particular communities to participate. And it just kind of continues to grow in large part because we don't get in the middle of it. You know, we don't come in and say, do it exactly like this. We say, we're going to resource. This is the North Star, you know, like, let's work together. You tell us what you need. And we're not going to come in and say it's compliance and you have to do where we take the money away. You know, this is long-term change work.
Maybe just a clarification on funding and investments. How how is the work being funded, and then who manages the integration of these types of investments?
I was really hoping you'd ask. I caught that one in the chat, and I said that's a super important question. We use a braided funding model. So what we do is we pull together typically anywhere between 18 to 20 different state and federal funding sources based on the appropriateness of those resources. And they are divided into two blocks. One block is what we call core infrastructure, and that's to invest in the capacity development component of the work. And then the other block is really more transactional programming work. And the idea there is that as you build capacity infrastructure, we can layer on programs, right? And programs are short sprints, 2 to 3 years, 4 years. They're for a particular project. They're aligned with the community's needs. The community defines really like how that resource is invested, but that starts to become their portfolio. As they grow their resource, additional investors come to us or directly to the community. And frequently what we will encourage is, rather than bringing money and saying, hey, invest it in the state and the state will invest it back in the community, we say, just go to them. You know, work with those folks, make an investment based on what your priorities are or what you want to do. And we've seen philanthropy definitely, as well as the private sector, really get interested in saying, rather than us hoping that maybe the $50,000 that we're going to allocate to per community for 10 communities is going to go somewhere. We know that this network is bigger than our investment, and whatever we put on the table there is going to go way further than if we just hopefully do something. So, you know, we use that braided funding methodology as sort of the backstop or the foundation of the work. And we bring together resources that are both public health and non-public health on the state side to make those sorts of investments. As I'd mentioned on the onset of my presentation, you know, we're in the process of actively moving this out of the public health agency and into the Executive Office of Health and Human Services, which is the oversight organization for all health and human services in the state, and is part of the sort of executive cabinet in the governor's office, meaning that, you know, there's a core group of folks that are meeting with the governor very, very consistently that represent commerce, represent health and human services. And that gives us the ability to bring community priorities to those broader conversations and help to continue to diversify the funding stream. The other strategy that we use is that, you know, it's really having that conversation with the different programmatic and transactional funders to say, look at the value that's being created by you not having to recreate the wheel every time you make a public investment. It seems strange, but it does get lost sometimes in sort of who are we working for. And because we receive our money from the federal government or from state appropriation, and we have oversight from either the state or the federal government, there sort of starts to be this dynamic where we're reporting back and forth between the federal government or the state, and the community that we're serving, that those resources are directed to, starts to not be part of the equation. And what we continuously promote and push is, regardless of what your program is, it's all going to go out the door, right? It's all going to go, because it's community facing, you're a public institution. It's all going to go back out to the community. Wouldn't it be great if every time you did that, you didn't have to like start from scratch? You know, there was a group of folks who were already working in the particular geographies, because Rhode Island's not getting bigger. If anything, with climate change, we're getting smaller because the bay is growing, right? So, you know, those communities are still going to be there. And thinking about that as an intentional infrastructure investment, and the way that we operationalize that is by saying, look, 10 to 15% of your program budget, think of that as an investment in infrastructure, and put that into the pool of funds that is really for establishing, maintaining, and sustaining the core infrastructure for this model within our state, and helps us to both keep what's there, but then also continue to enhance what and grow across the state and diversify within those particular geographies as necessary.
Great. Thank you so much, Christopher. Really appreciate your time. We're at the top of the hour here, and
Thank you for having me.